Assalamualaikum warahmatullahi wabarakatuh. My name is Nurin Farhin Nabila binti Muhammad Hamidi, and today I'm going to present about leukemia. Leukemia is a type of cancer. Cancer starts when the cells in the body change or undergo mutation and grows out of control. Leukemia is a different type of cancer. Leukemia is a cancer in a bone marrow which caused by an abnormal increase in the amount of white blood cell. The bone marrow are thick and contain spongy liquid where the new cells are made. Leukemia cells are different from normal blood cells and the cells do not function properly. There are two ways of grouping leukemia. First, by checking into how quick the disease develops. Second is looking into the type of the blood cells that are affected. In acute leukemia, the abnormal blood cells increase rapidly and the disease gets worse easily. However, in the chronic leukemia, the abnormal cells increase less rapidly compared to the acute leukemia. Leukemia can cause many problems and be found in different ways depending on the organ that is affected.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Amal Fida binti Ibrahim and I am from class AS120 3G. For now, I will explaining about Jenny cases about factor of acute lymphocytic leukemia ALL. Actually, this disease has no solid proof that the factor is detected, but we can also know the disease through the risk factor, which is the increase of the risk acute lymphocytic leukemia to happen. This disease also commonly happen on the children of between age 2 until 5 years old. So the first risk of acute lymphocytic leukemia is from the genetic disorder. So actually, acute lymphocytic disorder is not strongly inherited component. It also don't run in family, but in some cases of this acute lymphocytic disorder disease to be happen is some of cases if a pregnant woman giving birth to the fraternal or identical twins, if the twins have genetic problem like leukemia, so the other one has the risk of getting the acute lymphocytic leukemia. Also, if in any family siblings, or even the parent itself having a Klinefelter syndrome or even Down syndrome, the risk of the children to have the acute lymphocytic leukemia is high. So the second risk factor of acute lymphocytic leukemia is radiation exposure. So this is referring to the medical imaging tests like X-ray or CT scan. This exposure of radiation before birth can increase the factor of getting old for the child. So in this case, doctor will take a precaution to have a small possibilities radiation exposure, especially for women and children. So a part of the radiation exposure, chemical exposure also contain the risk of getting acute lymphocytic leukemia. So chemical substances such as benzene, which is likely used in producing industry, which is mostly contains in cigarette smokes, glues, detergent, cleaning product, and also in art supplies, also one of the risk factor in getting all, but it's a small possibility of getting them. So last but not least, the risk factor of acute lymphocytic leukemia is previous cancer treatment. So in this case, if one of the patient is having some of disease that required to having a treatment like chemotherapy or radiation, this may trigger the factor of getting the acute lymphocytic leukemia. So all of this is the risk factor of acute lymphocytic leukemia. Also, the scientists until now been researching the real factor of acute lymphocytic leukemia happening. Of course, of the all this risk factor is related to acute lymphocytic leukemia, but it still don't strengthen the exactly and directly causing the acute lymphocytic leukemia to be happening. So that's all for the factor of acute lymphocytic.
Assalamualaikum and hi. My name is Aina Baiduri and I will be explaining about acute lymphocytic leukemia. Acute lymphocytic leukemia, also known as acute lymphoblastic leukemia, is a type of cancer of blood and bone marrow. The word acute refers to the fact that the disease progresses rapidly and creates immature white blood cells instead of the mature ones. This type of cancer is a common cancer that happens to children but also can happen to adults. So what happens in acute lymphocytic leukemia? First of all, bone marrow produces stem cells that has the ability to develop into three important types of blood cells, which are red blood cells, white blood cells, and also platelet cells. Bone marrow does not usually releases the stem cells into the blood before they are fully grown, but in acute lymphocytic leukemia, a large number of white blood cells are released before they are ready. These cells are called blast cells. As the numbers of blood cells increases, the number of red blood cells and also platelet cells decreases. This causes to the symptom of anemia such as tiredness, breathlessness, and an increase of excessive bleedings to happen to the body. Blast cells are also less effective than white blood cells in fighting bacteria and viruses.
Hello and Assalamualaikum. My name is Raihana binti Baharudin. It is understandable why Jenny's parents could not understand or find infection is a major problem for Jenny while her white blood cell count is high. It is true that white blood cells, which include lymphocytes, help the body to fight infection. As a matter of fact, lymphocytes are made in the bone marrow, which is the spongy red tissue in the inner part of the large bones. Lymphocytes are the main cells that make up lymph tissue, a major part of the immune system. This lymph tissue is found in lymph nodes, the thymus, the spleen, the tonsil, and adenoids, and is scattered throughout the digestive and respiratory systems and also the bone marrow. Lymphocytes develop from cells called lymphoblasts to become mature infection-fighting cells. There are two main types of lymphocyte, which is B cell and also T cell. B cell help protect the body by making proteins called antibodies. The antibodies attach to germs such as bacteria, viruses, and fungi in the body, which help the immune system to destroy them. While T cell, there are several types of T cell, each with special job. Some T cells can destroy germs directly, while others play a role in either boosting or slowing the activity of other immune system cells. Acute lymphocytic leukemia develops from early forms of lymphocytes. It can start in either early B cells or T cells at different stages of maturity. In short, healthy lymphocytes fight bacterial and viral infection. But in Jenny's case, new lymphocytes do not develop into mature cell but stay as immature cell called lymphoblasts, as stated before by Aina. Plus, these lymphoblasts also proliferate uncontrollably and are found in large numbers, fill the bone marrow and crowd out other normal cells, which preventing the production of red blood cells, many other types of normal white blood cells, and also platelets. Hence, lymphocytes lack its function in fighting infection, which also means Jenny's chance to get any infection is higher than other people without this disease. Besides that, having a weakened immune system is a possible complication for people with acute lymphocytic leukemia, since immune system is less able to fight infection due to lack of healthy white blood cells. Moreover, having a weakened immune system makes you more vulnerable to infection. It also means that any infection is more likely to cause serious complication. One of the symptoms of infection may include high temperature, headache, aching muscles, diarrhea, and tiredness. In addition to that, as treatment for acute lymphocytic leukemia, one of it is chemotherapy. Chemotherapy will damages our blood cells, so another causes for shortage of healthy white blood cells increase the chance of getting infection. Even though the blood count gradually returns to normal as the bone marrow recovers after chemotherapy treatment, any patient who has been treated with chemotherapy is at a risk of infection. The risk do depend on the type of chemotherapy being given, but infection were common during intensive chemotherapy or after high-dose treatment given before a stem cell transplant. In addition, aside of infection, having acute lymphocytic leukemia will also cause Jenny to bleed and bruise more easily because of the low level of platelets in her blood. Last but not least, as precautionary measures, Jennies need to avoid contact with anyone who has an infection, even if it's a condition that she were immune to in the past, such as chickenpox. This is because her previous immunity to this condition will probably be lower. It is important to go outside regularly for exercise and for her well-being, but she should avoid crowded places and using public transport during rush hour.
My name is Sarah Safia binti Hassan, and I will continue with the treatment for children with acute lymphocytic leukemia. The main treatment for children with acute lymphocytic leukemia, which also known as ALL, is chemotherapy, which is usually given in 3 phases. The first phase is induction, the second phase is consolidation, and the third phase is maintenance. The entire length of treatment is typically about 2 to 3 years, with the most intense treatment in the first few months. Children with ALL are classified by risk group to make sure that the correct type and doses of drugs are given. The first phase is induction. The goal of induction is to achieve a remission. This means that the leukemia cells are no longer found in bone marrow samples, the normal marrow cells return, and the blood counts become normal. 95% of children with ALL enter the remission after 1 month of induction treatment. ALL children also get intrathecal chemo, which is chemo into the cerebrospinal fluid, which also known as CSF, to kill any leukemia cell that might have spread to the brain and spinal cord. The second phase is consolidation. Consolidation phase of chemo starts once the leukemia cells is in remission and typically lasts for several months. This phase further reduces the number of leukemia cells that are still in the body. Several chemodrugs are combined to help prevent the leukemia cells from developing resistance. Intrathecal chemo is continued at this time. The third phase is maintenance. If leukemia remains in remission after induction and consolidation, maintenance therapy can begin. Most treatment plans use daily 6-mercaptopurine and weekly methotrexate, given as pills, often along with vincristine, which is given into a vein, and a steroid. These latter 2 drugs are given for brief periods every 4 to 8 weeks. Other drugs may be added depending on the type of ALL and the risk of recurrence. Some children at higher risk may get more intense maintenance chemo and intrathecal therapy.